this evening. We're going to be talking with our partners at DCEO about the local cure program. We'll be speaking tonight with Phil Keshen and also Jonathan McGee from DCEO. So those gentlemen, we appreciate you joining us tonight and kind of letting everyone know about the programs that your agency is offering and the help that can be provided through those programs. So first of all, tonight I'm going to introduce State Fire Marshal Matt Perez to kick off things tonight. Fire Marshal, take it away.
All right, thanks, JC. Welcome, everyone. As we all continue to adapt and overcome the challenges that are brought on by the COVID pandemic in our personal and in our fire service lives, the financial hardships brought on by these adjustments are starting to become a little more clear. The expense of additional PPE, supplemental manpower, and a drop in available funding sources due to the COVID restrictions are circumstances that none of us could have predicted. Since the beginning of the pandemic, the OSFM has done our best to listen to the needs of the fire service, distribute the latest guidance and recommendations, and find operational and financial support for our departments and districts. Like every endeavor in the fire service, we find success when we work together as a team. Today, I'm honored to bring the Department of Commerce and Economic Opportunity into our team. DCEO's Phil Keshen and Jonathan McGee have joined us to present information on the Business Interruption Grant and the local coronavirus urgent remediation emergency programs. This is an opportunity for you to hear firsthand which program is right for your department or district and how to successfully apply. At the completion of their presentation, we'll have OSFM Fire Service Outreach Manager Greg Hay with us to review FEMA grant opportunities that are currently available and provide helpful advice on how to fill out the applications. And without further delay, I'll turn the floor over to Phil Keshen, who can expand on the business interruption grants and the local cure programs. Phil?
Thank you, Fire Marshal. Really appreciate your partnership during this time. It's important for state agencies and all Illinoisans to come together and try to align our resources, our limited resources, with the various needs of the public. And this is an example of how we've done just that by connecting our agencies to deliver this presentation. So thank you so much. I will be covering components of the Coronavirus Relief Fund and the local CURE program, and my counterpart, Jonathan McGee, he's a deputy director of our regional economic development team. He'll be talking about the business interruption program. So once again, I'm Phil Keshen, the Chief Financial Officer for the Department of Commerce and Economic Opportunity. So this is our presentation on big and local CURE for fire protection districts. So we'll be talking about two programs, and the two programs have the same funding source. And I think it's important to lay the groundwork to understand where the dollars are coming from. They're not, the state doesn't have the authority to just print dollars for stimulus. The Coronavirus Relief Fund was provided by Section 5001 of the Federal CARES Act back in March. Use of CRF dollars, you'll hear that acronym time and time again, is authorized by that section, as well as the Treasury guidance that gets released by U.S. Treasury. So after the presentation, you'll get a copy of this deck, and you could click on these different hyperlinks, and I'll click on them throughout the presentation just to kind of show what you'll end up seeing. Hopefully my screen's coming up okay. So if you click on the U.S. Treasury website, you'll see information about the Coronavirus Relief Fund as a funding source, as well as tons of guidance that's out there for it. So the funding source itself was designed for cover expenses which are necessary and they're incurred due to the public health emergency with respect to the COVID-19. There were costs that were not accounted for, expenses that were not accounted for in your budgets at the time when that act was passed on March 27th, and then later was not covered in your budget shortly thereafter. And they were incurred from the time period of March 1st of 2020 through December 30th. So we have a very short window to get the rest of these dollars out the door, and therefore costs incurred through December 30th. So what did the state do with the coronavirus relief dollars that are received from the feds? Well, several of the counties got direct allocations from CRF. Cook County, DuPage, Kane, Lake, and Will counties all got their own allocation from CRF, as well as the city of Chicago. But then the state of Illinois was given the balance of the $3.5 billion, or excuse me, given $3.5 billion to appropriate to different programs. And the full list of programs can be viewed from a report by the governor's office. I'm not going to go into that in great detail, but just to briefly mention, the programs covered costs related to PPE and alternative care sites, testing and contact tracing programs. There's a rental and mortgage assistance program. There's mental health, substance abuse, and other counseling services, pandemic stability payment programs for healthcare providers, and then there's two programs at DCEO, which will cover in part the Business Interruption Grant Program, which is for economic support for small businesses, and the local government reimbursement program called the Local Cure Program. So how does this apply for our audience here tonight? So looking at DCEO's COVID programs for fire protection, we have to kind of bucket the folks in this call into really three different groups. The first group are those that are listening to this webinar, watching, or on the line right now, that are here on behalf of volunteer fire departments. You're trying to find out how to receive additional funds. You haven't been able to hold like pancake breakfasts or spaghetti dinners as fundraisers, and you've essentially had what we call an interruption in your business due to the pandemic because of the health guidance doesn't allow you to have those types of gatherings. And so we're going to point you to the Business Interruption Grant Program, and we'll walk through that. So if you are a volunteer fire department and you're located anywhere in the state of Illinois, you may apply for this program for a chance to receive assistance. The next two buckets are for fire departments, which are a government entity. So a fire department that is part of a municipality or county government, and they're located outside of DuPage, Cook, Kane, Lake, and Will counties. The Local Cure Program will be the program that you're going to be focusing on in this presentation. If you're a fire protection district, meaning you're a local government as defined by the Illinois Constitution, and you're outside of those counties, Cook, DuPage, Kane, Lake, and Will, and you're not under your own municipality, county, your own separate taxing district, you'd apply directly to our program, our Local Cure Program for assistance under Allotment C, and we'll outline that here shortly. So to start off, I'll pass it to Jonathan McGee to talk about the volunteer fire departments and the details there. Jonathan.
Awesome. Thank you so much, Phil, and thank you so much, Fire Marshal JC and the whole Fire Marshal team for convening everyone here tonight. As Phil shared with you, I am the Deputy Director of Regional Economic Development here at DCEO. I also wear a dual hat as Acting Deputy for our Office of Minority Economic Empowerment. So really excited to share with you all more information about the business interruption grants. Next slide, Phil. So as you all know, Governor Pritzker and the General Assembly came together to pass funding for our business interruption grants, as well as leveraging our CARES Act dollars to create one of the largest grant programs in the nation. Our business interruption grant program was about $540 million. We took about $270 million of those dollars to provide to IDHS, which launched their child care restoration grant program. And then the rest of the funds we reserved for our program here at DCEO. In our first round, we gave out about $49 million in grants to about 2,800 businesses. We learned during that time that the need was way more expansive than the folks we were covering there. And so really made a huge significant amount of improvements in the second round. The great part about this is, we really use an equity framework in how we really divvy up these funds by specifically looking at what I'll talk about later is DIAs, which are disproportionately impacted areas where they've been impacted by COVID, have been historically marginalized, and have received a lower amount of support just in general across the state. Next slide, Phil. So big round two. As Phil shared, this program is way more expansive. We have about $200 million and funds available for small businesses, including nonprofits, available statewide. I do want to flag this one piece. We have about 100 million earmarked specifically for downstate Illinois, which means that most of these volunteer fire districts that are in downstate have a significant amount of funding that is allocated for them as well as other businesses. And so I just want to kind of underscore that because if there's any fear of that the money's going to run out, or do I have a chance of really getting access to these funds? I think the short answer is yes. And so, of course, we have money allocated for, the kind of 7 counties as well. But I just wanted to kind of also emphasize the fact that we know a lot of rural communities have just not seen the same level of support. And so, again, when we think about equity, we wanted to ensure that downstate was not left behind. We've got about 70 million allocated for what we call, like I said, disproportionately impacted areas, or DIAs. And, these, we have a list of zip codes on our website. So if your volunteer fire departments want to look and see if they're in a DIA, then they can check that out on our website, and we're happy to share this PowerPoint afterwards. This is more for larger industries, but we did set aside money for what we call heavily impacted industries, which are your museums, your event venues, your event spaces, and private charter transportation as well. So just wanted to share that. And our grant partner is Axiom and the Women's Business Development Center, who's helping us to administer this. So we also have other eligibility factors, which I'll kind of talk a little bit about. So eligible businesses must be for-profit and nonprofit entities with 20 million or less in annual revenue and have experienced losses due to COVID-19. The great part about this grant is that it's scalable according to your losses, which means that if there's fire districts, nonprofits, volunteer organizations that, like you said, can't do their spaghetti dinners, can't do their annual events, and you potentially have, lost to $150,000, as long as you can prove that, of course, through looking at the last 2 months from 2019 to 2020, you can be eligible for a significant amount of money. And this is again just completely assessed on that losses piece. And so want to walk a little bit through too how we're prioritizing organizations. So if you did receive PPP and EIDL and other federal CARES money, you are still eligible, but you just will not be prioritized as much as maybe those other districts that did not get any of those funds, those volunteer districts that didn't get those funds. Again, we will prioritize volunteer organizations that are in DIAs, which again, there's a list of those on our website. Another piece of this, so for those folks that may have been in the Metro East, about regional mitigation, and I know right now we've got some folks in other regions across the state that are experiencing this. As you know, when we see high positivity rates for a consecutive amount of days, IDPH implements what we call regional mitigation measures. And so what this does is making sure we're prioritizing those folks that now are suffering again from high COVID rates. And then the last piece here is, this is a small business grant program. And so we want to ensure that, folks that have less than 5 million are prioritized as well. And then one thing to note, and I think Phil talked a little bit about this, there's just a no double dipping clause. So, again, if you've used, PPP for payroll and that funding is still being used, just ensuring that big is not used for the same thing or, for the same expenses, because these are all the same pot of money. Last but not least, we have a myriad of technical assistance and outreach partners. And, I'll start kind of with, some of our technical assistance partners. We're working with the, Illinois Hispanic Chamber of Commerce. We're working with the Urban League and other folks, as well as other grantees. But I think what could be most helpful for this group is really my team, which is the Office for Regional Economic Development, as well as our small center. But I will also send a map. I keep my handy dandy map here. I'll send a map out to the group, which we have a Team Red member for the most part in every region across the state. And really, they can help walk folks through this application, answer questions that you have, and just generally point you in the right direction in case there's anything that doesn't make any sense. Uh, and yeah, I mean, I think the last but not least piece here is check out our website. We have FAQs, we have a checklist, we have the draft application, and essentially all of the information you need. Thanks, Phil, to get your application in. Just to let you know, we've only seen about roughly almost 15,000 applications. So there's still a ton of money out there. There's still a ton of opportunity. If there's any districts or folks that are like, well, I don't know if I want to do this, I don't know if I'm going to get it, or, we're just tired of the state, please push back on them. I think what Phil will share with you with Local Cure and what I can share with you here is that this is a lot of money. And in our first round, we didn't even use it all. So the application again are rolling, so there is no deadline on this until we're going until the funds are exhausted. So as you can see, the applications are live. We're going to actually start awarding our kind of first rounds very soon, but again, we're reviewing applications on a week by week basis. If there's anything that's not right in the application, we reach out to folks at least 2 to 3 times to flag it for you. But again, I think the biggest thing that I want to underscore here is that making sure that folks do their due diligence as well. We have seen Google Auto Populator, right here you go for do's and don'ts, just making sure that you're complete, it's accurate. We do have it in English and Spanish. And last but not least, we do encourage folks to save their answers and make sure they have a copy of their application. And then again, just double checking your answers, making sure that you click the right priority industry, because I think, some folks may, think that they're heavily impacted, and they may be, right? But we have a certain definition of who those folks are. And so just being sure that you kind of check the box that most applies to you. And then again, Google Populator proved to be a nuisance our last time around. So just double checking, names, business ID and address and all of those things to ensure that you populated correctly.
Thank you so much, Jonathan. So that was the big program, and once again, now it's for volunteer fire departments that are registered nonprofits. Please apply. Once you get this deck, you can just click on, I hyperlinked all these different links. You just click on the link and go. Reach out to him and his team if you have questions. I believe at the very end of this deck, I have their general email address, which is ceo.teamredinquiries@illinois.gov. We'll make sure everyone gets a copy of that. So that was for volunteer departments. I'm now looking at fire departments, which are part of a municipality or county government. So looking at Local Cure on the last 2 rungs that I mentioned at the start, kind of recapping what those would be. So if you're a fire department and you're within a municipality or county government, and you're outside of Cook, DuPage, Cane Lake, and Will counties, your local government has already been allotted funds under this program. So what I would ask you to do is look at this guidance that we're giving and look internally to your own local government leadership and determine, who has the certification document and what are they doing with it? Are they spending it on something else? Because, fire protection and safety should be at the very top of the list here. So there's we call it allotment A. So if you are a fire department that's covered under a county municipality, you're part of allotment A, and the list of allotment A awardees is right here in our deck, and it'll link there from our website. So the next and final group is for fire protection districts, which are considered their own unit of local government according to the Illinois Constitution, and they're located outside of the Cook, DuPage, Cane, Lake, and Will County region. So those fire protection districts can apply on their own and receive their own allotment. And to apply for assistance, you go to our website and click on the allotment C funding opportunity. And so I've linked directly to that opportunity here. It's a Smart Sheets intake, and it's really easy to fill out. You basically say, yes, I'm part of a local government. Am I in the collar counties? No. And then indicate what type of district I am, and so in your case, you'd say other, and then from there, there's not a whole lot of questions you have to answer. You just have to tell us your DUNS number, your contact information, who's authorized to sign, and give us an estimate of your costs. So it's a pretty easy application. If you were to get to that application from DCEO's website, illinois.gov/DCEO, you click on Local Cure here, and this is where all the host of information that we have, and the Allotment C link is right here on the website. The Allotment C funding, it closes every 2 weeks on a Friday. So right now we have a little bit over 11 million left to allot throughout the state. And the next funding window closes this Friday at 4 p.m. So if folks get their entries in before Friday, you'll be part of this funding window, and we will continue to host additional funding windows until it's drawn down. So just a really quick FAQ, just based on a couple things I just mentioned that might be popping in folks' heads. What if you're a local government or a fire protection district located inside of Cook, DuPage, Kane, Lake, and Will counties? So this program, Local Cure, was appropriated from the state's allocation of CRF. And under state law, we may only serve governments that are outside of that region. So you'll have to seek assistance within the county government. So you'll have to seek assistance under DuPage County or Cook County or Lake County or Will. What if, another question might be, what if we serve partially within the above region, but partially outside of the region? So if you're a fire protection district and you're applying for Allotment C, you just indicate that on your application, and we'll create a special condition to make sure you could receive a proportion of funding for the population that's in or out of the region. And then another question that could come up right now, if you're listening to this and you're already participating in the program, if you're already participating under Allotment C and you've drawn down your funds, you may apply for additional funds through that same link. So you'll go to the Allotment C link and fill it out and just tell us about the increase that you need. We'll only increase your allotment if you've already drawn down those funds. So it's important to not bite off more than you can chew, because then otherwise other groups won't be able to get into the pool of funds. So we've talked a lot about how to apply, and so I'm going to run through pretty quickly details about the Local Cure program itself. And so the Local Cure program, as I've mentioned several times, it's for the regions outside of Cook, Lake, Will, Kane, and DuPage County, and you must be a unit of local government to participate or apply for individual assistance. We've posted all the different allotments under the program. So there's the amount for counties and municipalities, the amount for local health departments, and then we've funded around 9 million of the 20 million so far in applications under this Allotment C. And I encourage everyone to go out and apply for Allotment C. To participate in the program, it's very simple. There's really three steps. Once you've applied for assistance and our window has closed, we will send a certification document. It's kind of like a grant agreement, but there's less details in it. There's less red tape associated with it. You don't have to be registered in the GATA portal. The certification, you review it, you sign it, and return it to the grants team member that sent it to your unit. And then shortly thereafter, you'll receive a registration link to log into our portal. So the first step is to sign and certify. Second step is to register in the portal. It's just basically creating a user ID into an electronic portal. And then the last step is to complete your reimbursement request. So Local Cure is a reimbursement program. You will submit to us invoices, proof of payment, and a justification for your expenditures that are COVID related, and submit them to us through that portal. And within the portal, we'll review it and provide feedback if needed, or pass it along for payment. So if you are a fire protection district that's under a county or a municipality government, this step one is already in process, and hopefully they're on to step two already. And if you're having a hard time connecting with the right person within your unit on who has the certification document, because it's likely been emailed to someone as in like a grants role at the local government, please try to search internally. Otherwise, email our grant chief. His name is David Parr. His address is right there. So walking through the eligible costs. So these are things that you could have already incurred, costs that you've already spent, and you have basically from March 1st through December 30th to claim these types of costs under the local CURE program. So medical expenses, including but not limited expenses establishing temporary public medical facilities and other measures to increase COVID-19 treatment capacity, COVID-19 testing and emergency medical response expenses itself, public health expenses, which may include communication and even enforcement by local governments of public health orders. This includes the purchase of PPE, includes the purchase of media for public health messaging and related to mask wearing and social distancing, expenses for establishing public health programs to purchase PPE. Not a lot of things that fire protection districts will do, but we'll get more into the meat of what you'd probably be claiming. But from a local government perspective, public health expenses is something that can be claimed and in order to help folks adhere to the guidance. So probably the biggest section that fire departments are looking to cover are payroll expenses. The local governments through the states have all had downturns in revenues due to COVID pandemic and have had very little opportunity to generate additional revenue. And while revenue replacement is not a proper use of the funding source, it's prohibited at the federal level, we can cover expenses that align with the Treasury guidance. So the Treasury guidance says that payroll expenses for public safety, public health, healthcare, human services, and similar employees whose services were substantially dedicated to mitigating or responding to COVID-19, those would be covered costs under this program. You might ask, what does substantially dedicated mean? Just recently, the U.S. Treasury provided additional follow-up on that term. Governments may presume that a public health or public safety employee meets the substantially dedicated test unless the chief executive or equivalent of the relevant government determines that the circumstances indicate otherwise. So what that means is if you are considered a public health or public safety or healthcare employee or human services employee, you are considered substantially dedicated to mitigating or responding unless your chief executive says otherwise. An example for like a police department, they need to enforce laws. And so really, if there's laws associated with public health guidance, then it's reasonable to think that it's a substantially dedicated cost if they're enforcing laws. For fire protection districts and firefighters and emergency medical, really every single call that you go on has a potential COVID component to it, and you need to be able to be mindful of that and incur the cost to make sure that your folks are remaining safe. Following up on the payroll, what public safety and public health employees are covered. This is straight from the guidance as well. Public safety employees would include police officers, sheriffs, deputy sheriffs, firefighters, emergency medical responders, correctional and detention officers, and those who directly support such employees such as dispatchers, supervisory personnel. Public health employees will include employees involved in providing medical and other health services to patients and supervisory personnel, including medical staff assisting in schools, prisons, and other institutions, and other support services essential to patient care, as well as employees in public health departments directly engaging in matters related to public health and related to supervisory personnel. So it's a lot of information. You might be asking, what sort of documentation is needed to submit our payroll? So the entirety of the local CURE program is reimbursement. So you need to have incurred the expense and paid for the expense, and then come to us with invoices and ledgers proving that you paid for it, and then substantiate it being folded into the program with a justification. So we created this table indicating that there's just a few things that we need for documentation. And if you're a public safety employee, which firefighters are, the justification is really just to indicate that these are all firefighters and they were substantially dedicated public safety employees. You know, that's the extent of the justification. Unless the chief executive says otherwise for your local government, that is the case. So the ledgers for the local government, including payroll, time, and human resource records for the actual expenses per employee. We also ask that you provide us what's called a lead sheet that breaks down the employee cost by person, because we still need backup documentation that stands up to audit and proof that the expenses were incurred for the reason as intended. So if you're a public safety employee, really the justification that's needed is just a simple statement. If you're a public safety related administrative employee, so think of like back office staff, we will need a little bit more than just a statement of justification. We'll need really some timesheets or something to corroborate the time spending on COVID-19. And that's really because those folks could be doing a lot of other things in addition. Other costs that are covered under the local cure program are expenses for actions taken to facilitate compliance with COVID-19 public health related measures. So if you're trying to comply with the public health related measure in your own fire station, as you incur those costs, they can be covered under this program. And then any other COVID-19 related expenses reasonably or necessarily for the unit of local government to respond to the public health emergency that satisfies local cure program eligibility. You must document how the expenses related to COVID-19 itself. So there's a lot of allowance here to do a little bit more than even what's inside those particular list of expenses. Things that are ineligible are things like shortfall in revenue replacement. Those are things that we can't cover on local government side. Damages covered by insurance, payroll benefits for expenses for employees whose work duties were not substantially dedicated. So any payroll that's not substantially dedicated would not be able to be covered. Expenses associated with economic support, not eligible under this program. Reimbursement to donors for donated items. Workforce bonuses, other than hazard pay or overtime. So what we're saying here is you can't provide bonuses to your firefighters, but you can provide hazard pay, and the hazard pay can be covered. It could also be covered for overtime costs. We just can't release bonuses and then seek reimbursement for them. We cannot cover severance payments or legal settlements. Indirect and admin costs cannot cover indirect costs, but there is a provision to now allow admin costs. And if you have further questions on how to fold that in, please reach out to us. And then other costs incurred that have been or will be reimbursed through another funding opportunity would not be covered as well. So we cannot permit double dipping of expenses. So there's a lot of information about the local cure program, what can be covered, what cannot be covered. Please go to our website to read more about the opportunities. And one of the quickest ways to see if it's an eligible cost or not is by reviewing the expenditure and seeing if it passes the reimbursable expenditure test. So essentially, if true can be said to all of the things listed here, then the expense can be covered under the program. So the expense needs to be connected to the COVID-19 emergency. It needs to be necessary by the interpretation of the local government themselves. You are the ones that are on the front lines. You are the ones that can attest to the necessity of the purchase. The expense isn't covering shortfall in revenues. It has to be the case. The expense is not funded through another budget line or allotment. The expense is not being reimbursed through a different program. The expense wouldn't exist if not for COVID-19, or if the expense would be substantially different. That you need to stay true to that. And also the expense was incurred through the covered period, March 1st through December 30th. So it's a lot of information. My last slide here talks about really the most recent guidance that we've released. One of them is the public health and public safety payroll related and indicating what is substantially dedicated. We provided some written guidance on that, which can be accessed from our webpage if you click here. This is the statement that DCEO has released on that guidance. If you're navigating from DCEO's webpage, illinois.gov/DCEO, and you click on local cure, we've tried to arrange the page in such a way that it's easy to find some things. Here's some additional guidance on eligible expenses. So there's some statements that we've made. One of them was about substantially dedicated payroll. The other guidance document we released is we reviewed CDC guidance for public spaces and have recommended if local governments, through the opinion of the public health experts within their unit, say that those costs should be considered, we've indicated how they could be folded in as costs under the local cure program. So if you're trying to implement CDC best practices, we're looking to fold those costs in as easily as we can. That covers everything that myself and Jonathan had on local cure and BIG. I'll leave this slide up there for a bit. If you have questions, technical questions about local cure, we have a dedicated email address that our administrative partners assisting field questions. It's localcure@crow.com. And if you have questions for Jonathan's team, the Regional Economic Development Team, reach his team at ceo.teamredinquiries@illinois.gov. And that's it for my presentation. I'm happy to answer questions.
Thanks, Phil and Jonathan. We really appreciate this tonight. It's a lot of information to digest. If folks, you have questions, there's the chat feature on the side of the screen over here, or you can also send me the questions at jc.fultz@illinois.gov. That's just the two letters, jnc.fultz@illinois.gov. We'll have another little question and answer session coming up in a few minutes after I hand it over to Greg Hay here in a few seconds to talk about another funding opportunity, this one from the FEMA grants. But if we have questions for Jonathan or Phil, we can get those into me as well. And if you like the presentation, Phil, send it to me. If you'd like it, email me again at my email address. I can forward that out to you so you have a copy of it and it has those nice hyperlinks, like you said, Phil, in there that people can click on and take them to those places, correct?
Yes, that's correct.
Perfect. Sounds good. So without further ado, well, if you have those questions, send them in. We'll get back to you to those questions here in a few seconds. I want to introduce the Office of State Fire Marshal's Greg Hay. He's our Fire Service Outreach Coordinator. He's going to talk a little bit about the FEMA grants that are available as well. Greg, I'll let you take it away.
Thanks, JC. Hi, everybody. I hope you're all doing well and staying healthy out there. I just want to quickly brief you about the AFG's supplemental grant that was just released last week. This will be for COVID-related expenses, specifically personal protective equipment and supplies used to either prevent or respond to the COVID-19 situation. Now, this is actually the second round of the supplemental grant for COVID expenses. But this round is going to be limited specifically just for volunteer and combination fire departments. FEMA's allocated $31 million for this, and they estimate approximately 500 grants will be awarded. The matching portion for your departments depends upon your population. If you're under 20, if you serve an area of under 20,000 people, you have a 5% match, and for anybody over 20,000 population, it'll be a 10% match. Now, the applications were released last week on October 6th. The application deadline is going to be November 13th at 4 p.m. our time. So notice on their website they say 5 p.m., but that is Eastern time. They anticipated selection and award date is going to be January 15th. All departments that are eligible to apply in this round, even if you were awarded a grant in the first round, you can still apply for another grant, but your request has to be to support either a new or additional need or capability. It just can't be to something to add on to your last award. For anybody who applied in the last round but was unsuccessful, You can reapply, but you have to start from scratch and do a new application. Your previous application won't be carried over. Now, as I said earlier, this is going to be for PPE and PPE only, and you can request money to cover reimbursement for any PPE expenses going back to January of this year. Some ineligible expenses that you might think to try to request for would be any thermometers, medications, N95 fit testers, any kind of separation barriers, plexiglass, and the like, COVID testing kits, and pulse oximeters. So none of those will be eligible for this grant. Now, most of you are very familiar with the AFG grant process. It's been out for many, many years. A lot of you know it a lot better than I do. But if you want to know more about this one, you can go to the grants webpage. It's at usfa.fema.gov/grants. And there's a 36-page PDF on there that has all this information that I've covered and a lot more. JC is going to be posting a link to the webpage, I think, tomorrow morning. So, like I said, you guys know this AFG grant forward and backwards pretty well. So with that, if you have any other questions, you can send them to JC here in the chat. Otherwise, I'll just hand it back off to you, JC.
Thanks, Greg. We really appreciate that. And again, like Greg said, I will be posting this AFG grant information on our Facebook and Twitter page on the Fire Marshal's office Facebook and Twitter pages tomorrow morning. It goes out at 9:30 in the morning. So all you have to do is click on that. It will drive you right to that link Greg was talking about, and you'll be able to see all of that information for the AFG grant program there. Right now, I don't have any other questions for Phil and for you, Jonathan. Phil, I'm going to let you kind of have some final thoughts here on things that you can think of here before we wrap up tonight. Is there anything that you want to kind of touch back on really quick that people may have a question about?
You're on mute, Phil.
I was double muted on my phone, muted on the I just wanted to say thanks. Just want to say thanks to the Fire Marshal and team for putting this together and giving us a platform to speak and try to, help units throughout the state receive assistance in a much needed time. Please go to illinois.gov/DCEO and click on Big or click on Local Cure. That's the launching spot for both these programs. And, JC, please pass around the deck widely after this, and folks could click through that. And I appreciate the time. Thank you.
Thank you, Phil. Jonathan, do you want to say anything before we get done?
Yeah, no, just thank you all again. Again, I cannot stress enough. I have an entire team that is dedicated to supporting you all throughout this process. I will send over our regional map so that you all know who's in your specific regions, but whatever we can do to assist you in applying for these funds, whether it's C or it's big, I think this. So thanks again.
No, thank you again, Phil and Jonathan. We really appreciate your guys' cooperation with this as well. And I'll be posting this recording up on our Facebook page as well tomorrow. And if you go to our Facebook page, sfm.illinois.gov, there's a link to this program. I will get this PDF put up on our website as well that has all of this information that you guys sent over. Fire Marshal, I'll let you have the final thoughts here tonight.
Thanks, JC. So I'd like to thank JC, Phil, Jonathan, and Greg for putting the webinar together tonight. It's great to see our sister agencies coming together to support our fire service. We're always going to dig and find every possible avenue we can to help you guys out. I'd also like to thank all of you for your efforts to keep your community safe in the face of the continued hardships we're facing. And I hope you found the information presented of value and you can take advantage of the opportunities that were discussed tonight. If you have any questions, please feel free to contact us or utilize our portal to ask questions specific to the district or your department. Please continue to keep the health and the safety of our firefighters as our top priority as we move into this next set of challenges presented by the COVID pandemic. Let's keep working together, one team, one fight.
Thank you, sir. Thanks, everyone. And again, this will be posted up tomorrow on our Facebook pages and also on our website. So thanks, everybody. Take care. Be safe. Stay well. See you guys.